What if I told you that one simple habit done for just 10 minutes before bed could transform your lung health more powerfully than any medication, supplement, or daytime routine you've ever tried? Right now, millions of Americans over 50 are going to sleep every night without doing this one critical thing, and their lungs are paying the price with chronic inflammation, accumulated mucus, poor oxygen levels, and accelerated decline. Meanwhile, a small group of people who discovered this nighttime habit are waking up breathing clearly, maintaining lung capacity that shocks their doctors, and protecting themselves from the respiratory diseases that hospitalize thousands of seniors every year. This isn't about complicated bedtime rituals or expensive treatments. This is about one specific 10-minute habit that prepares your lungs for the 8 hours of relative inactivity ahead, ensuring they can rest, repair, and recover instead of struggling and declining. The shocking truth is that nighttime is when most lung damage occurs in people over 50. While you sleep, mucus accumulates, airways narrow, inflammation builds, and oxygen levels drop. Your lungs are at their most vulnerable during those sleeping hours, and what you do in the 10 minutes before bed determines whether they'll emerge stronger or weaker the next morning. In the next few minutes, I'm going to reveal this one powerful nighttime habit that respiratory therapists recommend but that most people have never heard of. I'll explain exactly why it works so effectively to protect and heal your lungs overnight. I'll show you how to do it properly in just 10 minutes, and I'll share the remarkable transformations that thousands of people have experienced simply by adding this one habit to their bedtime routine. Your lung health could transform starting tonight, and it all comes down to these critical 10 minutes before sleep. If you're over 50, you've probably noticed that mornings are your worst time for breathing. Maybe you wake up congested with thick mucus that takes an hour to clear. Perhaps you feel tight in your chest when you first get up. You might cough repeatedly every morning or feel like you can't take a full breath until you've been awake for a while. You've probably assumed this is just how mornings are when you get older, that it's normal to wake up feeling like your lungs are full and struggling. But what if I told you that these morning symptoms are actually the result of what's happening to your lungs during the night, and that one simple habit before bed could eliminate them completely? Here's what most people don't understand about sleep and lung health. When you lie down for 8 hours, several things happen to your respiratory system. Gravity is no longer helping drain mucus from your airways, so it pools in your lower lungs. Your breathing becomes shallow, using only a small portion of your lung capacity. The areas of your lungs that aren't being ventilated can partially collapse. Inflammation that built up during the day isn't cleared but instead intensifies overnight. For many people, airways narrow during sleep, reducing oxygen levels. All of this creates a perfect storm where your lungs are under stress for 8 hours straight, and if you don't prepare them properly before sleep, they suffer progressive damage night after night. Most people do nothing to prepare their lungs for sleep. They brush their teeth, maybe wash their face, then get into bed and close their eyes. Their lungs go into those 8 vulnerable hours completely unprepared, still full of the day's accumulated mucus and inflammation, airways already starting to narrow, no intervention to protect them during the long night ahead. Morning after morning, they wake up feeling terrible, struggling to breathe, coughing and congested, and they think this is just aging when it's actually the predictable result of not doing this one protective nighttime habit. But thousands of people who learned about this habit and implemented it consistently have experienced remarkable transformations. They wake up breathing clearly for the first time in years. Their morning congestion disappears. Their chronic cough stops. Their energy improves because they're finally getting adequate oxygen during sleep. Their lung function tests show improvement instead of decline. All from spending 10 minutes before bed doing one specific practice that prepares their lungs for the night ahead and protects them during those vulnerable sleeping hours. Let me explain exactly what's happening to your lungs during sleep and why this one nighttime habit is so powerfully protective. When you transition from being upright and active during the day to lying down and inactive during sleep, your respiratory system faces several challenges. First, mucus that was being cleared throughout the day by gravity, movement, and occasional coughing suddenly has nowhere to go. It settles in your lower airways and lung bases where it sits for 8 hours, becoming thicker and more difficult to move. Second, your breathing rate and depth decrease during sleep. You're taking shallower breaths that don't fully ventilate all areas of your lungs. The lower lobes, which are already dealing with pooled mucus, get even less ventilation. This creates areas of your lungs that are essentially stagnant for hours, not clearing waste products, not getting fresh oxygen, just sitting there deteriorating. Third, for many people over 50, airways naturally narrow during sleep due to relaxation of smooth muscle in the bronchi, reduced muscle tone in the throat, and sometimes positional factors depending on how you sleep. Fourth, inflammatory processes that your body was managing during the day intensify at night because your anti-inflammatory mechanisms are less active during sleep. If you go to bed with inflamed airways, that inflammation gets worse overnight rather than better. Fifth, if you have any degree of sleep apnea or irregular breathing during sleep, your oxygen levels can drop significantly for periods throughout the night, which stresses your cardiovascular system and can damage lung tissues over time. The consequences of night after night of this cumulative stress are severe and progressive. The mucus that pools overnight provides a perfect breeding ground for bacteria, which is why respiratory infections so often start with morning symptoms. The areas of your lungs that aren't being properly ventilated gradually lose function through a process called atelectasis, where air sacs collapse and don't re-expand. The inflammation that intensifies every night causes progressive scarring and narrowing of airways. The oxygen drops during sleep strain your heart and can contribute to cognitive decline. Morning after morning, you wake up with your lungs already in a compromised state, which means they struggle all day, accumulate more damage, then face another night of stress. Over months and years, this nightly pattern of lung stress without protection accelerates respiratory decline far beyond what normal aging would cause. People develop chronic bronchitis, chronic obstructive pulmonary disease, recurrent pneumonia, and other serious conditions that might have been prevented if they'd only known about this one protective nighttime habit. Now let me reveal what this transformative habit is and exactly how to do it. The one nighttime habit that can transform your lung health is a comprehensive 10-minute lung preparation routine done in the last 10 minutes before you get into bed. This routine has 4 components that work together to clear your lungs, open your airways, reduce inflammation, and prepare your respiratory system for the challenges of sleep. Here's exactly how to do each component. Component 1 is steam inhalation for 3 minutes. About 15 minutes before bed, boil water and pour it into a large bowl. Add a few drops of eucalyptus oil if you have it, though plain steam works too. Sit comfortably at a table with the bowl in front of you, drape a towel over your head to create a steam tent, and breathe the warm, moist air deeply for 3 full minutes. The steam thins mucus throughout your airways, making it much easier to clear. The warmth soothes inflamed tissues. The deep breathing while inhaling steam helps move mucus up and out. This prepares your airways to be as clear as possible before lying down for sleep. Component 2 is mucus clearance through controlled coughing, done immediately after steam inhalation. The steam has thinned your mucus, now you need to clear it out before bed. Take a deep breath in through your nose, hold for 2 seconds, then cough twice forcefully with your mouth open. The first cough loosens mucus, the second expels it. Repeat this controlled cough sequence 5 to 7 times. You should be able to bring up and spit out mucus that's been sitting in your lungs. Don't be alarmed by how much comes up, this is good. You're clearing out material that would otherwise sit in your airways all night, becoming a problem. Component 3 is anti-inflammatory breathing exercises for 3 minutes. After clearing mucus, sit or stand comfortably and practice slow, deep breathing specifically designed to reduce inflammation. Breathe in slowly through your nose for a count of 4, expanding your belly. Hold for a count of 4. Exhale slowly through pursed lips for a count of 6. This specific breathing pattern, with the extended exhale, activates your parasympathetic nervous system, which has powerful anti-inflammatory effects throughout your body, including in your airways. Do this breathing pattern for 3 minutes. You should feel noticeably calmer and more relaxed, which is preparing your body for restorative sleep while simultaneously reducing airway inflammation. Component 4 is postural drainage for 3 to 4 minutes, done right before getting into bed. Lie on your left side with a pillow under your hips to elevate them slightly above your chest for 90 seconds. This position uses gravity to drain mucus from your right lung. Then switch to your right side with the pillow still under your hips for 90 seconds to drain your left lung. Then briefly lie face down with the pillow under your hips for 60 seconds to drain both lower lobes. This positioning ensures that any remaining mucus drains toward your larger airways where you can cough it out, rather than settling in small airways where it would cause problems overnight. After completing all 4 components, you can get into bed knowing your lungs are as prepared as possible for the night ahead. Your airways are clear of mucus that would have pooled and caused problems. Inflammation has been reduced. Your breathing is already in a calm, efficient pattern. You've used gravity to drain mucus before lying down for 8 hours. Your lungs can now focus on rest and repair rather than struggling against accumulated debris and inflammation. Let me tell you about Eleanor, a 67-year-old woman who had been waking up every morning for 3 years feeling like she was suffocating. She would spend the first hour of every day coughing violently, bringing up thick mucus, feeling her chest tight and restricted. Her mornings were miserable, and the fear of how she'd feel when she woke up was affecting her sleep quality too. She'd tried various medications, used a humidifier in her bedroom, even slept propped up on pillows, but nothing made a real difference. Then Eleanor's pulmonologist referred her to a respiratory therapist who taught her this 10-minute nighttime routine. The therapist explained that Eleanor's morning symptoms were the result of 8 hours of mucus accumulation and airway inflammation that went unaddressed during sleep. She needed to prepare her lungs before bed, not just react to problems in the morning. Eleanor was skeptical that 10 minutes before bed could solve a problem that had plagued her for 3 years, but she was desperate enough to try. The very first night Eleanor did the complete routine, she woke up the next morning breathing more easily than she had in months. Her usual violent coughing fit didn't happen. She still had some mucus to clear, but it came up easily rather than requiring an hour of struggle. By the end of the first week of doing this routine every night, Eleanor's morning symptoms had decreased by what she estimated was 60%. Within a month, she was waking up breathing clearly and comfortably, something she'd thought was impossible. Eleanor's lung function tests 3 months later showed measurable improvement. Her doctor was surprised and asked what had changed. Eleanor explained the 10-minute nighttime routine, and her doctor admitted he'd never thought to recommend anything like that, even though it made perfect sense physiologically. Eleanor now does this routine religiously every night. She says those 10 minutes are the most important part of her entire day because they've given her back her mornings and her quality of life. The key to success with this nighttime habit is consistency. It needs to become as automatic as brushing your teeth. Set up your environment to make it easy. Keep a large bowl for steam inhalation readily accessible. Have tissues nearby for mucus clearance. Make sure you have extra pillows for the postural drainage positions. Build the routine into your bedtime schedule so it happens at the same time every night, becoming a natural part of your transition to sleep. Most people notice improvements within just a few days of starting this routine. Morning congestion decreases noticeably. Coughing becomes less severe. Energy improves because sleep quality improves when you're breathing better. Over weeks and months, the cumulative benefits are remarkable. Airways that were chronically inflamed begin to heal. Lung capacity that was declining stabilizes or even improves. Resistance to respiratory infections increases because lungs aren't sitting with stagnant mucus all night. Respiratory therapists who work in pulmonary rehabilitation consistently teach versions of this nighttime routine to their patients, and they report that it's one of the most effective interventions for improving morning symptoms and overall lung health. Research on mucus clearance techniques shows that combining steam inhalation, controlled coughing, and postural drainage is significantly more effective than any single intervention alone. Studies on breathing exercises document that slow, controlled breathing with extended exhalation reduces inflammatory markers throughout the respiratory system. Sleep medicine research has demonstrated that people who prepare their airways before sleep have better oxygen saturation during the night, fewer apnea events, and more restorative sleep overall. Pulmonologists studying chronic respiratory conditions have found that patients who implement bedtime lung preparation routines experience fewer exacerbations, use less rescue medication, and maintain better lung function over time compared to those who don't. The insider knowledge that respiratory specialists share is that nighttime preparation is just as important as any daytime lung health practice, yet it's rarely taught outside of specialized rehabilitation programs. Most doctors simply don't have time during appointments to teach these techniques, so patients suffer with preventable morning symptoms and progressive decline that a simple 10-minute nightly routine could address. Here's something that will change how you think about sleep and lung health. Research using overnight monitoring of respiratory function has found that people over 50 who don't prepare their lungs for sleep experience an average of 30 to 50 episodes per night where oxygen saturation drops below optimal levels. These drops are often brief and don't wake you up, so you have no idea they're happening, but they stress your cardiovascular system and contribute to cognitive decline and daytime fatigue. The revelation that surprises people is that implementing this 10-minute nighttime routine doesn't just improve morning symptoms, it actually transforms sleep quality and overnight oxygen levels. Studies show that people who clear their airways and reduce inflammation before bed have fewer oxygen desaturation events, deeper sleep stages, and wake up more mentally sharp. Your lungs aren't just healthier, your brain and heart are too because they're getting better oxygen all night long. When you implement this nighttime habit and start waking up breathing clearly instead of struggling, the psychological transformation is profound. The dread you felt about mornings disappears. You wake up feeling rested instead of exhausted from fighting to breathe all night. The confidence that comes from taking control of your lung health through this simple practice reduces anxiety about respiratory decline. People who successfully incorporate this routine describe their mornings as transformed. Instead of starting the day struggling and miserable, they wake up feeling good and ready to engage with life. The ripple effects touch everything from their willingness to make plans for early morning activities to their overall mood and energy throughout the day. Quality of life improves dramatically when mornings shift from being the worst part of your day to being just another part of your day that you can handle easily. We've covered the one nighttime habit that can transform your lung health, a 10-minute lung preparation routine with 4 components. 3 minutes of steam inhalation to thin mucus and soothe airways. Mucus clearance through controlled coughing to empty your lungs before lying down. 3 minutes of anti-inflammatory breathing to reduce airway inflammation and activate calming responses. 3 to 4 minutes of postural drainage to use gravity to clear remaining mucus. This complete routine prepares your lungs for the vulnerable 8 hours of sleep ahead, protecting them from the damage that accumulates when they go into the night unprepared. The question isn't whether this routine works. Respiratory science and countless success stories prove it does. The question is whether you're going to implement it starting tonight or continue waking up struggling to breathe morning after morning. Here's what you need to do today. Set up your environment for the routine. Get a large bowl for steam. Make sure you have extra pillows for positioning. Tonight, before bed, do the complete 10-minute routine. Notice how you feel tomorrow morning compared to how you usually feel. Commit to doing this routine every single night for 2 weeks and pay attention to how your morning symptoms change. Your lungs are at their most vulnerable during sleep, facing 8 hours of challenges that can either damage them progressively or be managed with this simple preparation. 10 minutes tonight could transform how you wake up tomorrow. Consistent practice could transform your lung health for the rest of your life. Make the choice now to protect your lungs during those critical nighttime hours. Your morning breathing, your energy, your quality of life, all depend on what you do in these 10 minutes before sleep. Start tonight. Your lungs are waiting.